guys. Thank you for tuning in to Aesthetic Minute, where we're going to talk about aesthetics, a brief little discussion about aesthetics every week for just a couple of minutes. In our last episode, we talked about Botox in the upper face and where we typically treat with a neuromodulator up on the top half of the face. I just wanted to do a second one back to back about the lower part of the face, because this is an area that we don't really sometimes think about that we can treat with a neuromodulator, but there's a lot of wonderful places that we can treat for that. So let's go over those. Let's jump right into it. Number one is the masseters. So this is a big muscle back here that we use to chew with, and sometimes just genetically you might have a person with a little bit bigger masseter muscle, which might square out the face, round out the face, or just add a little bit of volume, unwanted volume into this area. You also might have a problem with clenching your teeth at night, TMJ, and those type of things. So just the stress of clenching, wearing down the teeth might be something that will drive you into having this area injected. The two things to know about that is if we're treating for just clenching the teeth, TMJ, or that kind of stress, it's going to be a little bit of a lighter dosing than it would be for something that we're trying to narrow or take away some of that bulkiness in that area. So the dosing is going to be quite different, and you'll talk with your practitioner once they do an evaluation to see what that dosing might be for you. Again, with just the clenching of the teeth, 20 units, 15 to 20 units, but if we're really trying to narrow that muscle or reduce the size of that muscle, it can get up to 50 units on each side. So you'll talk with your practitioner to figure out what's best for that.